According to my watch and the clock, it's 1 minute after 10, and I'd call the meeting to order at this time and ask that we stand up and pledge allegiance. Pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. At this time, we have a quorum, but we're missing 2 members. Anybody hear from Matt, whether he's going to be here or not?
I did not hear from Matt. I did get a hold of Mr. White Friday to let him know that the meeting was today at 10.
Okay. Okay, I'd like to ask that we look over the minutes of last meeting, and I'll move for the approval of minutes.
So moved.
Second.
All in favor, aye? Aye.
Aye.
Yes,
Mr.
Kathy?
Chairman, I would like to make a motion to remove items 6 and 7 from the agenda. It seems like we have quite a few things already listed on the agenda, so I'd like to make a motion to remove those at this time.
Okay, so moved.
Second, if you like.
Okay. Right. This time, we, on the agenda, number 4, we have a representative from Lakeview today that would like to address the board. If you would state your name, please, for the record.
Good morning, I'm Sean Salamita. I'm president at Lakeview Center. Thank you for allowing us to join you today. I've actually spoke with Dr. Williams a number of times about the history of substance abuse prevention type services available for children and youth in our community. So I'm here to answer any questions and speak a little bit to that. I have with me Edna Williams, who I'm going to turn the mic over to momentarily, who has a little bit more history with that than I do, having run our children's programs in the past, including DART, which was our residential substance abuse treatment program, which was actually closed before I took the position over Lakeview Center. Previous to this position at Lakeview, I had run Families First Network, so I was over the Child Welfare Division. I've been in the position over Lakeview Center for 4 years, almost 4 years. Definitely recognize the growing need for substance abuse interventions for youth in particular. We have a pretty broad range of programs for adults between our medication-assisted treatment programs, our residential program, Road to Recovery. We have substance use disorder overlay in our adult residential, long-term residential programs. So we have a pretty good continuum, and just recently added a 10-bed addictions receiving facility or detox facility within the last few months. So we have a pretty broad range for adults, but when it comes to services for youth, we're much more limited. So that's where I'm going to, and I do think it's an important conversation to have about the identified need for that in our community, and how to identify some strategies to bring that to bear for the youth in our community. So I am going to ask Edna Williams to come and speak a little bit more about the youth-oriented substance use disorders programs that we have and that we may have had in the past. If I could invite her up and turn the microphone over to her.
Okay, thank you very much, Sean. Please, Edna.
My name's Edna Williams. I am currently Director of Residential Services at Lakeview Center. Hey, Ms. Kathy. I was Director of Children's Behavior Health Services for probably about 20 years. And then recently we restructured. And so under me has DART. DART stands for Drug and Alcohol Adolescent Residential Treatment. So we had that program probably about 30 years or so. The program had about 16 to 20 teenagers that it served, all with an addiction diagnoses. Majority of those referrals were from our court system. And about 4 years ago, we made the decision to shutter that program, basically because of lack of referrals. And that is not unique across the state of Florida. We noticed that that was something that was occurring to a lot of our substance abuse programs, but it takes a lot of work. Of course, when we did do that, our judges in our community rose up because they were not aware of the closing, and so the communication channel was broken, I think, was part of the issue. It served our community, the four-county area, well, something that is currently missing. Right now in our community, as far as treatment for substance abuse at Lakeview Center, we have what we call our TASK, Treatment Alternative to Street Crime is what it used to be, but it's now communities, safer communities. That is responsible for any youth that are in the DJJ system that have certain hits on substance abuse. They are responsible for doing the coordination and the assessment for all of those youth. It was recently folded into our outpatient program. When I had it as a separate because of the specific criteria that we needed to address substance abuse. It takes that. And now we also have what I started probably 3 years ago, which is our TRACE program. It's an in-home intensive treatment program. We applied, Dr. Williams actually brought that to my attention a few years ago, and the need then was to find a way to treat children, adolescents that were at home but did not want or did not need the inpatient, the residential treatment portion. That is going very well. It has therapists, case managers, a wraparound team that goes into homes that does that intensive work. And we do have what we call our FIT team and CAPE. Those teams are more geared towards our child welfare system to assist families that are going through our child welfare system from losing their kids or to gain their kids' custody back because of substance abuse issue. And we attach what we call our CAPE program. It is a team of nurses that their responsibility is to attend to the babies, that 0 to 3 and now 0 to 5 age range, to make sure the milestones are gained, and if they're born exposed, to give them medical care and treatment. So those are the programs we currently have. I'm with Sean. I do believe there is a hole in our continuum. Substance abuse for adolescents is growing. I kind of pulled some data. Escambia County has a pretty robust amount of opiate dependence in our community. As you all know, I pulled data on, it did not separate from adult and child, but deaths and overdoses are really rising. And so we believe that that part of our continuum, because we don't have the detox portion for adolescents, we don't have the inpatient, we just don't have that for the deeper end level kids that are in our community that may need that level. And so I'm open for any questions that you may have for any of that at this point.
Kathy?
I have a question. On the TRACE, in-home intensive treatment, how large is that program roughly? Do you know how many participants?
I think it's around 40, up to 40.
40? And is there an age limit on that?
It's 13, and I think we rewrote it. At one point, it was going to be to 15 because we were trying to fill that gap for DART. I think now it's at 20, but I'm not sure. I think they had to regroup, and I do know that it's a SAMHSA funded.
I have one more question.
Okay.
Is this for those that are involved in the criminal justice system? Is this
It's not
particular program?
targeted for those that are in our criminal justice system. It is targeted for those that are in our community that have that need.
Okay, that's what I was curious.
Yeah.
I wasn't for sure if it was just for.
No, it's
one.
not a
Okay.
court-ordered typically program. DART was the only one that was typically court-ordered along with our TASK program. All of those kids can come from the court system.
Thank you.
Thank you, Kathy. I have one question. So right now, currently, we have no residential program for the children, for the youth?
Not for substance abuse treatment, no, sir. I think the furthest one is on the other side of Tallahassee.
Okay, and what about in the future, looking forward? Are we looking at that again? Or-
Everyone's looking to me to look to that again. I'm not sure, Sean can maybe speak to that. I'm over all the residential programs. If Sean, if you want to speak to that about residential treatment?
Yeah, we're always looking for opportunities for Lakeview to fill the gaps in the service continuum in the community. As I alluded to earlier, this is clearly surfaced in community conversations such as with this committee as a gap. So when we reach that identification, we'll start to talk to our potential funders. Northwest Florida Health Network is our managing entity. They provide the majority of our funding. So if there was an identified need there, if there was an identified funding source, we would certainly be open to look at a needs assessment, do a kind of do some projections on what level of service referral we might expect. As Ms. Williams alluded to, one of the reasons that we closed DART was because of a lack of referrals. Again, not uncommon for this level of care across the state. It's a very high cost level of care. And when referrals aren't coming in and you're not drawing down the funds, you identify a way to use those fundings for more kind of upstream preventative type services. Having said that, a lot's changed between the time that we closed DART and today. So again, if the need's identified and we have an identified funder, we're certainly willing and interested in looking at bringing that capacity back if we think there would be a demand for it.
What I'm hearing then is you feel there's a need for it, and obviously, according to what you said, judges feel there's a need for it, but there's a funding issue, bottom line.
Well, there's two things. Number one, it's one thing to feel that there's a need for it. We have to do some actual data analysis to make sure that the referrals would come and that the population is there. I suspect, based on some of the preliminary data that Edna alluded to, that we'll find that there is a population of need. But then, yeah, secondly, funding has to be identified.
Okay, Dr. Williams?
Yeah, just want to follow up on that funding question. Can you just speak to kind of the magnitude of what running a residential program like that costs, just in general terms?
Okay. So I had the budgeting piece for DART as well. And so DART overall was probably close to $1 million when in order to run it full. That does not mean we cannot scale it to another level, but then the level of need was significant for many, many years. And so that is what funding was needed in order to have. I think we're at 16 to 20 beds. And so the scale can be based on need for sure.
And Dr. Williams? Anybody else? Tommy?
Yes. Dr. Williams just answered one of the questions, and the gentleman right there answered another one. How many kids did you service a year with DART?
Roughly around 40 to 50 kids. It was a 4-month program, and so our goal was to try and have where they continued that whole 4 months. Some were 6, of course, as you can imagine, based on where they are. But I'll have to preference this. This was prior to our opiate
Correct.
incident. And so that was history. And so I would say now it would be a different number of kids based on what we need. And I would say that we also need to really strongly consider some type of detoxing method for adolescents, because it is a missing gap as well.
Okay, and so this was only referral based through the court system. So what about a person that just had a person like Ms. Shepherd that had the need for a
Yes.
her son wasn't through the courts, and they could just walk up. So could they not just walk up and get help?
Yes, sir. So when I was speaking about the court system, that is those were court-ordered, but any community teenager that needed that level of care had access to it as well.
And you didn't, so in your numbers as far as just people that wasn't referred, you didn't see you didn't see an influx of individuals that just needed regular care?
Yes, sir, we did. And so what for about a year or so, we did not. Prior to that, we had a very long history of serving a lot more kids in that range. Again, that is old history based on, back then I could, just looking at data on opiate trends, it would be different now.
And so how would a person that's just coming off the street, how would they facilitate paying for that service, or was that service paid for by the state, or how does that work?
It was paid for by our state funding.
By
So
state.
families were not receiving a bill for the service. Pretty much it was a SAM, meaning state-funded service. There were some, and you'll find many insurances do not cover substance abuse treatment. It is a lack, and I don't know why they don't, but they just don't. Even our adult programs, it's just not a covered service. And so our SAM funders, all of us understood that gap. And so for years, that's who funded it for both community and court.
And so you had a 4-month program. So as people wrote, I guess, how did your intake work? So if you say you had 16, how many beds?
16 to 20 beds.
16. So if you had 20 beds, and say like 20 beds were full at that time, did they go on a waiting list, or as people rotated up, they just they rotated out, and then you would do more intake, or how did that work?
Yes, sir. All of those things, based on the availability, it was just a phone call. You call and you receive an assessment, and then based on that assessment, you make a determination what level of care you needed and how acute your needs were, meaning how significant were the needs. And we would base who was coming in next based on those kind of things.
Okay, and so your annualized budget to run that program with 20 beds, roughly about $1 million a year.
Yes, sir.
Okay, all right.
Back
Well,
then.
yeah, I think the need is definitely there, and definitely look forward to having that conversation in the future. Hopefully, we can, that become one of our priorities to have a facility or a couple of facilities or whatnot to meet the needs of the community, because we're definitely in an epidemic type situation. So thank you all for being here.
No, thank you. No, thank you.
Okay, anybody else? Any questions? Thank you very much for your presence and giving us that informative information this morning, and we appreciate it.
Oh, you're welcome.
Thank you.
Thank
Anytime.
Next on the agenda, we have CDAC, Prevention and Treatment Needs and Goals. Alicia.
Good morning, everyone. Happy Monday. All right, so as CDAC goes in our prevention committee, we had some recommendations that the executive directors, Alicia Scribner, went over with me. And so part of having those discussions with the Northwest Florida Prevention Committee, and we also had a meeting with some treatment facilities where we could identify gaps where they also felt like the need for this community was. So it's on the agenda. So one of those was doing a larger opiate summit with international speakers. CDAC did host a opiate summit Saturday in Pace for the faith community, and then CDAC is also hosting one at Sanders Beach on June 15th. That is community-based, and we have addictionologists speaking and Narcan training. Lakeview will be there doing that, and some other life experience people, just to try and educate the community about what's going on in our community, what resources we do have already established, and how we can further identify gaps. And we will be discussing gaps during those summits as well. The other one is bringing awareness via media campaigns That was one of the things that they felt like needed to be more robust. Some of the committee members mentioned that. In school, youth, identify the gaps of what our youth needs are. We do recognize that there is a treatment gap, but where does it start? You know, does it start in high school? Does their substance use disorder start in middle school? Well, how do we recognize these adolescents' need prior to that? Where are their resiliency skills being developed? And that's really where the prevention model comes into play, where we know we have students captured. There are a couple of evidence-based curriculums. Yeah, we can go into the schools and do a presentation and say, hey, this is where you need to recognize these are the harmful effects. However, is it capturing that need to develop resiliency skills? Because that's really where it comes into play. And how are they developing skills? What skills do they need to problem solve? What skills do they need to really make good choices when they have a barrier in their life? So there's some really good curriculums out there to develop that. Also, there's some new evidence where they're talking about peer-to-peer support for adolescents, where you train peers to be that peer to help them talk through something until an adult is there to assist. So there's also that as well. So for example, one of the things that CDAC is doing, I know this is not about CDAC, but it's something that we talk about in the committee, we're identifying 3- and 4-year-olds and offering support and kindergarten through 5th grade support, developing those skills at this age. So when they get to high school, they already have these skills developed, and we're able to help them make better choices. So that's one of the things we talk about in the committee is where. Also supporting parents, offering more parenting classes. Right now, I know CDAC offers free parenting classes. I'm not sure of anybody else in the community that does that. Then when we had a treatment meeting with treatment providers, Lakeview was there, Baptist was there, some private treatment facilities were there as well. And we talked about how to, again, identify those gaps. One of the things that they also brought up is we don't have any youth inpatient treatment or outpatient treatment. I was able to identify one in Bonifay, but that is a faith-based one. There's 2 sober high schools where they do inpatient treatment. And the students also go to high school. We have 2 in Florida, but nothing close. So that's about where we're at with the adolescents, like Lakeview just said. Again, it does begin with prevention, but treatment definitely is needed. It's changed a lot. Our demographics as far as usage has changed since the DART program was initiated and done for a long time. So that has changed. During these meetings also, there was family support. It was talked about what are we doing to help our families? If a child or a family member has a substance use disorder, are we identifying these families to help them in also the recovery? We don't live in silos. If somebody is dependent on a substance, it is affecting the whole community, but it also affects the family. So is there a way we can help support those families, even in a death of somebody loses their life to overdose? So that was also a discussion. EMS was brought up during these meetings is also what are we doing for our first responders? Is there a way that we can help support them better in their compassion fatigue? That was also amongst discussion. How many calls they do a day? I think I just looked this morning. Last week we had 680 overdoses. I think that's what it was last week on site. So that's a lot. So that's a lot of runs that they're making. Are we doing anything to support them and their families and with this fatigue that they may be developing? Is there any EMS further services that funding might be able to support them in what they're doing as well. And then, again, access to treatment. So I know Lakeview has increased their MAT. I think that's been really phenomenal and robust. I'm not sure what Baptist is going to do when they open the new hospital. I know there's been some discussion, so hopefully that will help as well. So there are availabilities for adolescents. I just don't think also that that's being projected out in the community. What is available for our adolescents in what I said, prevention services, just not in the schools. Do you have any questions?
Anybody?
Anybody?
No que-
Mr. White?
yes.
Mr. White, you
Yeah,
don't
hi.
have any questions?
Yes. It's a lot of discussions here. So did you all decide on which action you say you all did a lot of discussing, so,
It's something
What
to
is the-
present to the abatement committee on how you want us to look at, do you want more data? Do you want us to, how do you want us to help facilitate some of this? Do you want, it really depends on what the abatement committee needs more from us. That's what I would share with our CEO. We have these discussions, but if you want us to develop a plan, I guess that would be a question I'd have to ask the CEO.
yes, sometimes, it's great to have a lot of discussions, but I think, we've been discussing since, what last, was it October or so? I think it's execution time
Okay.
now. I think one of them jumped out at me as far as the in-school plan that you all was speaking of dealing with the kids early on in school, whatnot, how we can, what do we need to do to execute that? Do we need to coordinate with school board to try to have some type of more seminars, things that, not seminars, but, kind of like in-school type activities? What do we need to do that? Do we need a street team for that? Do you all have enough people to do a street team to where you can go to these schools, or like we discuss them, but how would we execute these?
So there's two different ways to look at prevention when you're looking at adolescents. You go in and you do education to make them aware of the issue, but there's also a way to look at it as well as a preventative model, like I said, where you're helping them learn these skills so they don't use. So as an agency, that's something that, there's other agencies in this community that have that available as well.
Okay.
So it's just not a CDAC thing. I think
Right.
it all depends on, again, on funding and where we want to support this community. So there are models out there. So I'm hearing you want to hear about the models on how to initiate that. I don't work for the school board, so.
Right. I was just thinking,
I work for CDAC.
historically, you have the school board been receptive to kind of people coming in and doing, education. When we were in school, we had seminars in the gymnasium. Like you go to the high school, there'd be certain times they call the certain grades or high schools in and say, hey, we're going to have a seminar on Friday, whatnot, and in this case, it would be a opioid educational seminar. Have you all done anything like that in the past with high schools, or how do you, if you did partner with schools, how is that done? Is that reached? How have they been receptive in the past?
In the past, we have done presentations like that. It does capture some students, I will tell you that. But the climate has changed. Adolescents have changed. Social media has changed. So that type of venue where it is a good way to get overall education out. Since the climate has changed prevention-wise, we're really looking at more, I think, one-on-one and what that picture looks like in developing these skills. That's where peer-to-peer support has come along, and not necessarily one-on-one, but how do we help them develop these skills in the classroom maybe? that's something that the abatement committee can look at, just not for CDAC to initiate, but maybe that's something the
Right.
school board would like to look at some of those models. It can be intense as far as labor intensive, so that's what you need to think about. So think about it this way. If you have a group of 30 students in a classroom and half of them are struggling with how they identify with fitting into their community, and somebody addresses them with, let's just even say a drug, any drug, and says, well, take this and it's going to decrease your anxiety, it's going to decrease your feeling sad. And they're like, okay, well, it's going to help momentarily until I get myself back on track. And then it starts to spiral out of control. So how do we help those students, instead of feeling anxiety and overwhelmness, how do we help them develop the skills so they don't feel that way? They don't feel overwhelmingly sad, that they don't fit into their peers.
Okay.
Does that make sense?
Yes.
So assemblies work for knowledge.
Right.
It doesn't necessarily, I would say, the best practice for helping them draw out what their needs are and where they're struggling.
Okay. All
Does that answer your question? I hope?
Yes, we just got to get more community-based and youth organization involved as far as, getting education, getting knowledge, and actually getting the process of what you're speaking of, getting help, because CDAC can't, you can't be in all these places at one time. I mean, you're just one agency. So that's what I'm hearing from you. Like, CDAC is here, but then, we got to get mass coverage, so.
Yeah, we have, I'd like to say that we could do it all.
Yeah.
I'm going to get my CEO. But like partnering with Lakeview, where is that at? Partner with other organizations outside of school that provide those services as well. Going in and doing an assembly, that's something that CDAC has done. I've been there for 19 years. I've been doing it all along when I get called to do it.
Okay.
Does that make sense?
So basically-
So for like this year, I was called to an elementary school and I did a presentation prevention model to 4th and 5th graders because they felt the need, a concern. But that's a one-day event,
Right.
which, again, it focuses on knowledge and awareness, not on the root cause sometimes of what our adolescents are dealing with in today's world.
Okay.
It's different now.
Okay, thank you, Tommy.
Thank you.
Dr. Williams?
Yeah, I just want to, again, appreciate the information that was shared. And for me, it kind of looks at kind of the bigger picture of some of the needs. And I think part of the challenge or the call for this group is to kind of prioritize where funding ought to go and looking at the whole continuum, looking at what needs to be done in the prevention sector, what needs to be done in the treatment sector. And so getting this information to the board gives us some places to start. But then really the work for us is to kind of look at, based on this input, based on these identified needs, how do we prioritize them? And so again, I think this is helpful information, both what's presented here and also Lakeview's perspective on what's happened and not happened as far as residential services are concerned, that's what we're here for, to get that education. And then ultimately, we're going to need to set some priorities in terms of how the funding is doled out, but also looking at it, from my perspective, as a continuum. It's not just prevention or not just treatment.
Right.
It's looking at the whole continuum.
The whole continuum and, and how we can better serve this community. There are gaps and there's needs. One of the things, looking at I know this is moving forward, but looking at the Opiate Summit in June, that's one of the things that we are going to be engaging the community members that attend that summit with a gap analysis. Where do our community members believe that there is a gap? We as professionals can be up here, but where does the community see the gaps are? So hopefully we'll get some engagement during that time as well. We've allotted quite a bit of time for that, to identify the gaps and have conversations at your table and what they believe the solutions to those gaps are. Because they're living it every day too. just not the professionals.
Okay. And thank you.
So-
Kathy, did you have something?
I did. As far as the summit that's coming in June, is that geared for, when I think of community, just people out in the community, or is it really geared for community leaders to come together and
It's-
identify gaps? I'm just curious about that part of it.
Ms. White, it's open to anyone.
Okay.
So we have Dr. Stavros, he's an addictionologist, he's going to be the keynote speaker to explain what the disease of addiction is, for anybody to understand. Lakeview's giving a MAT training, medically assisted treatment training, to, again, educate the community. There is some stigma behind MAT. EMS is going to give a Narcan training. We all need Narcan training. How to administer that, what happens, what's the process. And then we'll have people there with life experiences to say this was our path. And that will help, I believe, engage other community members of, it's just not our family that's struggling. It's a lot of families. So how can we come together? So it's really, the goal is to open it up to anybody. And hopefully we get a lot of community members. Right now, I didn't look at the numbers this morning, how many people I have registered, so sorry. But, yeah, Sanders Beach.
Lisa, what are the hours on the summit?
The doors will open at 8:30. I brought some flyers too for y'all.
Okay.
Doors will open at 8:30 and will end at 4:30. Law enforcement will be there to give their perspective as well. Somebody from the Attorney General's office is speaking. And so I think it will be very comprehensive for community members to get educated on what's going on in our community.
Okay. Thank you, Alicia.
Real-
Dr. Williams?
Real quickly, is anyone from the school system participating with you?
As far as a guest speaker?
Yes.
No, not right now.
Thank you.
My agenda's pretty tight.
Gotcha. Okay.
But that's for future. We're always looking at moving forward and how we can do a better job to engage the whole community. The superintendent is invited.
Okay. And this is from me, I'm not speaking for the board here, but what I would like to see from Lakeview is some programs based on science, evidence that you feel would work in the community, and keeping in mind, I don't know how much we have now, Christy, but I mean, this is not an infinite amount of money that we have access
Right.
to. And you start talking about funding an in-house residential thing, that money's gonna be gone real quick. And, so I think we need to try to do something that will have an impact on the community, whether it be from Lakeview, from CDAC, and then I want to speak also to the EMS side of things. I know when David Tercel came and spoke with us back in the fall, he had some programs he was trying to get started on. I'd like him to come back to us and talk about where he stands with those programs, and can we help with this funding in that aspect of any programs that he has ongoing at the time we're trying to get off the ground. So that's what I would like to see is, like I said, keep it in mind, it's not an infinite amount of money that, as you know, dealing with budget all the time, and Lakeview knows dealing with budget, you got to prioritize, but what works and what's worked in other parts of the state, what's worked in other parts of the country that you feel we could assist with funding through the county commission to help you with, so.
I think addressing all of this and what Dr. Williams said is, as an abatement committee, is there a certain area that we want to identify adult? Do you want to identify adolescents? Do you want to try and do encompass? What does that picture look for the abatement committee as well? Where you as a committee believe the need is. The need is across all age groups and social economics. But where can we start? Where can we start the efforts to better our community and to better our community? So it's really that. But yeah, there is funding out there, but there is a cap, right?
I know for me specifically, as Lakeview mentioned, pulling the data to see exactly what's going to work best. You had DART before, and I know that program was running for quite a while, but really seeing what is needed right here in our community. If we could start seeing some of that data, that would be beneficial for us.
Thank you, Kathy.
So, and again, just to preface that, prevention, there isn't a lot of data because it takes years. So if you use a model like tobacco prevention, it took us 20, 30 years to really see the positive effects. So prevention takes a lot longer than data when we look at treatment. Seatbelt safety, we didn't see the effects of that with tragedies, with traffic accidents until later on. So keep that in mind when we're talking about prevention, because we won't know until later on.
Yeah, I think I'm speaking more specifically to the treatment side of things.
Yeah, of course, of course. All right,
Thank you, Kathy.
anything
Okay.
else?
Anybody else? Okay, Alicia, thank you very much for the presentation this morning. See, we have one speaker, Mr. Jones.
Good morning.
Morning.
I just wanted to come and just share that we are a community-based organization, and I just want to talk a little bit about the services that we currently offer in Escambia County. The reason is that so often that we see historically these gaps in services, but more so we see gaps in the services who are provided to particular demographics. And that's why I'm here. We currently contract for the Department of Juvenile Justice. We predominantly serve youth in this county, have been doing that for the last 7 years. Well, we provide evidence, we use evidence-based curriculum, true thought, choices, those types of curriculums that are associated with adverse behaviors from youth, particularly from Escambia County school systems. Most of our youth come from Escambia County school systems all over the county, from elementary school all the way to high school. Unfortunately, many of those youth have committed some law violations. We wanted to be able to expand it. We could talk to you for days about how we can expand it, how we can reach more of these particular youth, which are being serviced right now in Escambia County. Most of the youth that come to us, we know they come from environments where their issues persist, from their homes, from the environments or the neighborhoods that they live in. So we not only service our youth, we service our youth parents. We have partnerships with folks like Northwest Florida or Emerald Coast Legal Aid, because many of our young people, their families find themselves in adverse positions and conditions when it comes to housing, when it comes to dependency issues and things like that. So we have the ability to be able to connect them through our partnerships with those people and partnerships with people like REAP, who house homeless people. We find that many of our youth find themselves in that position based on their families not having a place to stay. And we have to understand that dynamics that's going on. The stress that comes just with not having somewhere to stay, just with living in these environments, push sometimes our youth to indulge in these particular behaviors which are substance related. And so we just wanted to talk just a little bit about who we are. Again, we've been established since 2004. We've been servicing Escambia County through the Board of County Commissioners. We provide diversionary services to them through a contractual agreement. We currently provide services to the Department of Juvenile Justice, a contractual agreement to provide services for individuals who have caught their first offense, young people predominantly. That's who we serve, from the ages of 8, well, the youngest we've had was 9 years old, and the oldest we've had was 19. That tells you in between that these young people, age is kind of, kids are starting to use as early as elementary school. So we want to be able to catch them at the front door. We want to be able to provide these services to them that'll help them to understand the detriment of substance use. However, we still got to look at all of the conditions that exist when they go home and the environments that they live in. So if we're servicing that youth and we're going to send them back to that very same environment, we have not done anything. We have just unwound the wheel we just wound up. And so we provide those services for youth, and we've been providing them for a number of years to greater Escambia County area. And we just wanted to share that there are other agencies out there. And we have to remember, sometimes when it comes to large conglomerate agencies, they kind of miss particular populations in services. Not that it's intentional, but sometimes there's this fear of engaging these particular organizations who've been in this county for years, servicing populations, but missing particular segments of our population. So we wanted to just say that we're here and we're providing these services. New World Believers Hoops, healthy opportunities and options, promoting success. We're at 2112 West Young Street on the corner of Young and P. Thank you.
Hello, Mr. Jones. You laid out a number of services in which you're providing.
Yeah.
So, you know, we're tasked with a number of things here with the Opioid Abatement Board. How do you feel that your organization could be a benefit to what the goals in which we're trying to accomplish?
I think we could be a great benefit. We currently partner with the University of West Florida. I'm an intern supervisor. So we get a plethora of young people who are coming, professionals who come there, who are able to connect with these families, who are able to make home visits, who are able to help them with wraparound services and those types of things. Because I came from that particular environment. And I know just one component is not the end-all, be-all. If I'm using substance, you got to still look at the environment that I'm in, some of the situations and circumstances that exist in those environments that push me deeper into this substance abuse. So we got these connections that kind of help us have many more arms than people would think.
So you have a infrastructure right now ready to go.
Yes.
That could actually assist and help the youth and do the things that we've been tasked with. So your infrastructure is already in place and already up and mobile, and you're running. You're off the ground and rolling.
Yes, sir. We currently provide these services, and we provide transportation to a lot of our young people simply because we understand the issues that exist in particular communities. And a lot of times that's what happens. The agencies that have the funding or the resources forget about the issues, the other issues that coexist with the issue that they're trying to address.
So one of the things that come up today is in-house services. Mm-hmm. So of housing, I think lately we had DART before. So in the future, if that is a model in which the board says that we need a gap that needs to be filled in the community, you know, how equipped are you all to, or what have you, in the past experiences have you had dealing with that type of in-house treatment?
Well, we've provided, me, myself, I was the Director of Transition for Pathways for Change. I was also the Program Manager of Pathways for Change, which was a therapeutic community. Most of the individuals who came through that particular facility were dually diagnosed, substance abuse and mental dispositions. So I was able to run that program for a number of years. I was that program director and that program manager. So I was able to help provide those services. So in being equipped to be able to manage an inpatient facility, I've already have that pedigree. I'm currently a clinical mental health counselor of psychology, scheduled to take my licensure exam June 23rd. And also I am a PhD student at Walden University. So I do have the background or the pedigree to actually run an inpatient facility. And then it's all about building the right team to actually facilitate.
Okay, excellent.
All right. Thank you.
Alicia? Yeah. Denise, I mean.
It's okay.
Sorry.
Denise, it's okay. I just want to comment what Rodney says. So again, I don't work in the treatment field, but having these meetings, again, it's about having those discussions. And what Rodney said, sometimes working with a treatment facility, I know with adults, and it may work with adolescents, I don't know the research behind it, but when an adolescent or an adult receives inpatient treatment, or they need those wraparound services when they get out. So it's about building those communities, like Rodney said. And maybe one organization provides treatment, but then we partner with another organization that can do those wraparound services when that individual needs that support when we get out, because we know that there is a high risk when somebody leaves treatment to reuse, because those wraparound services aren't there. That support system isn't there. So that's a good way to look at partnership when we already have things established. So that's all I have to say.
I have one last question for everybody and everyone in the room. I see 3 different agencies here. Do you all currently work together at all? And like, I'm hearing like there's these different pieces, but then I'm hearing that we need to bring all of these individual agencies together and let's solve these issues, because I know Lakeview, we know what you all do great. CDAC, you guys do. Rodney, New Hope, and see, like, you know, I don't think a lot of people in the community know what you all do, but you all seem to do a lot, and that's unknown. And so it'd be great, and like Chief Mathis says, the EMS director, the program that he's bringing on board is called the CORE program, which is a federal program that was, you know, that's handed down. So it's like we have these people here, but we're doing things in sections, but if we could unify and get everyone on the same board, and hopefully we can do this through this board as a driving force, a unified force throughout the community, I think that would be something great, and I think it's very doable, because yeah, you guys are you're already doing it. It's just, you know, it's just kind of like coordinating everything together with all the agencies together in a common goal throughout the community, from you all to the EMS to the school board, and everybody have the same mission, same goal. So.
Okay, thank you. Tom?
Yeah, just as a follow-up to that, I think that's happening to some degree in terms of coordination and meetings with different agencies, but there's always the opportunity for more of that in terms of whether we talk about the prevention side or, again, talk about the continuum, that I don't think anybody thinks that they have the corner on the market, that there's certainly a need and an opportunity for all of the different agencies to work together.
Thank you, Dr. Williams. Kathy, have anything? Yes.
If I could just add to Irv's follow-up. I agree. Community organizations need to be working together. And I would say that while there is room for improvement, we're getting better and better at working together on behalf of the people in this community. I've seen it at Lakeview Center. We have individuals that you all may see in the community, downtown, out of town. There's a pretty good chance that we know that individual, we've encountered that individual, and we're working with other organizations to develop a plan around that individual. So we're getting better at that. On the planning side, I think we're getting better at that too. How do we bridge our different programs and identify gaps? And this committee and this effort definitely gives us an opportunity to do that. So I guess I just want to respond by saying I completely agree, and I think many of us that do this work day in and day out, show up every day to do this work, agree. We can get better at working together and developing our continuum together and addressing individual needs together. We're getting better, but there's still room for improvement.
Thank you, sir.
Sure. Thank you.
Let me just tell you what I've handed out in front of you, and I'm sorry I didn't have enough copies for everybody. Oh, here's an extra copy, but we're going to have Tino put it on the website. Can you hand one to Tommy? I think he's the only one that didn't get one. So one of them is the substance use dashboard. I think everybody has one of those. And then also there was the Pensacola Opioid Summit handout flyer. Those will both be going on your webpage. I don't, you'll have to ask her. Do you have any more of those flyers? Okay. The other thing I wanted to point out, you don't have to take the approach of we're going to fund everything for the whole time. If you'll recall, you did a $25,000 expenditure last time you were here. I can't give a report on that. That's going to have to come from Wes. I can tell you there's interest. We have gotten inquiries. So there's an interest in that area. So keep in mind, you could do you remember when Jeff Lovingood was here? You could put together, we would like to, so for instance, there was a discussion about what can we do for the youth and the teenagers. So you could put together a request for inquiries into that. Lovingood can work with you and get that set up. So, and then you can say, well, we'd like to put $25,000 towards that. And you could send that over to the Board of County Commissioners and let it go, just like you did with the first 25,000. You certainly have 25,000. I think you just kind of need to get in the habit of let's put together what we want this to go to, see if those questions and if there's any interest in anyone who wants to come forward and put in bids for that, and then just send it over to the board for them to make determinations on that. So just start getting the handle of how to get requests out there, how to get bids back in, and how to get that money, get the recommendations over to the board, because the board can handle those items. And you may want Wes and Jeff to come back in and talk to you about it again, and probably, Stefan. I'm not tracking your money. I send things over when I get them, but I am not an accountant. So, okay.
Okay, thank you. Any other business come before today?
Just a comment or follow-up on Christie's comment. While I think we had a specific request for the funding that we approved, it was real concrete and specific, and given our conversation today about different programs, again, I think this board still needs to look at a little bit more globally and not just looking at 25,000 here, 50,000 there. What is it that we're really going to prioritize, and then to put out the request for response from the community. I think, again, that's kind of our charge. So, again, collectively as a board, we need to kind of have that conversation maybe at our next meeting in terms of how do we want to structure that before we start sending out requests for money.
Do you want to put that on the agenda for next time?
Yes, sir. Sounds good.
So for the next time you want her y'all are going to pick a topic and decide what you want to focus on for the next agenda?
Yes, on the next agenda to really discuss how we're going to prioritize what we want to request the people in the community to respond to in terms of funding.
Okay, so here's my recommendation.
Okay.
Put that in a detailed email over to Tina Arroyo so she can get it in the agenda appropriately. Because she doesn't get a lot of responses. I know that Kathy White regularly responds. She gets other things from outside of the organization, outside of this, but she doesn't get a lot of emails to give her what she needs to know to put on the agenda. And without having that type of input and asking, and we want Wes Moreno there, and can we have somebody from purchasing there, and can we, those types of things, if you don't give her those details, it's not her job. She's just trying to put it together for you. We've done a lot of that going forward, getting to this point, but you're the people that have to tell her what it is exactly that you want.
Go ahead. Well, through the discussions that we've had since October, one of the biggest gaps that I see that we have in our county is, and it keeps coming up, and the reason, forgive me that I keep harping on this, but the story of Ms. Shepherd really kind of initiated this. And I know we're dealing with not an infinite amount of funding, but I think we need to get the ball rolling back on a youth intake program. There was DART. DART is no more. We see the need. We see what's happening. We know that there's a need. we have outpatient services and outpatient therapy. We have outpatient this and that, things of that nature. Excuse me, I don't remember your name from Lakeview, but she said they have some things now that they're going to the home now that kind of to try to, you know, take the place of DART, but just kind of like in the home. But it breaks my heart when I think of a person like Miss Shepherd that went all the way around different places in the country trying to get her son help and couldn't find any. And they ended up killing herself or overdosing. And the closest place that we have is on the other side of Tallahassee. I think that is, I believe that is our utmost responsibility, and I believe in all of my heart of hearts, if we can get a facility back up and running and find, I think that should be our first request for proposal. So let people lay out a plan and say, I can do this, and show us and what it would take to fund that. And then we can wrap these other things around that situation, because a lot of this, the other stuff, the outpatient, the education, the wraparound service, they're already happening. Our biggest gap right now that nobody's facilitating is like if your youth needed some help right now as an inpatient, you can't get it. So it's right there in front of us right now. We can do all the seminars, we can do all of that, we can do this, we can do that. But people are dying now. And there's families out there that are screaming for help with kids under 18. There's places for adults already. Maybe not enough, and I know it's never enough. It's never enough, especially in this epidemic, but I think we have to fill that gap. I don't know if we do I have to put that in an email? Or can I just, what do we need to do, to get that conversation going?
When Tina sends out the email that says, what do you want on the agenda? Then you put it on then you send her an email back that explains what it is that you want on the agenda.
Okay.
Understanding she's not going to do the research for you.
Right.
Yeah, so whatever it is you want discussed, you're going to have to come ready for that,
Roger that.
okay?
Thank you.
The only, and I appreciate what you're saying, but then you need somebody to come in, keep in mind, you're going to need someone to tell you how much money you have. I think that's why I suggest the small amounts to get you started so you understand the process. And $25,000 to an organization like his is not a small amount.
Oh, I understand. But I'm with Dr. Williams.
And I would point out, too, you might want to go back over the past notes from our other meetings, some of the reports that had been submitted, where I believe that we submitted a report from that gave statistics on deaths from overdoses. So you want to go back and look at those again, too.
Kathy?
Yeah, I was going to say, we've been given a lot of information, and just as Dr. Williams was talking about, putting it on the agenda so we can talk about it here, and doing the homework. That's a big key to this, so, and looking at it and how we can bring it all together.
Thank you. All right. Guess next business would be the next meeting.
Thank you.
Looking at June, I've sticking with a Monday, I'm not available until the 19th of June, Monday the 19th. I don't know what anybody else's calendar looks like.
That works for me.
Is that a holiday for the county? I believe it is.
Tonight,
That's Juneteenth.
okay? Want to go to the 25th, or the 26th, I mean?
I won't be available. I'm out of town.
You, what, Dr. Williams?
I'm out,
You're
out of town on the 26th, yes.
Okay.
Just one person.
I'm out of town also.
Okay.
Or
That-
have a meeting.
Scratch that one then. Plus you got the item you want to bring on the agenda, Dr. Williams. Back.
Based on that, it looks like your next available Monday would be July 10th, because I believe the 3rd, you don't want to do anything the week of the 4th.
Yeah, that's the 4th.
And it may be a county holiday, I don't know.
Yeah. Okay.
They don't put holidays on my calendar.
July 10th, how does that look to everybody?
It's not good for me.
Not good for you, all right?
Sorry about that.
It's all right.
No, they don't have to be on a Monday.
Summer is just,
You may want to consider that you not do it on a Monday, just so
Yeah,
you can
if
get
we
a
could do it-
meeting.
I was thinking, of course, you're gonna love this, how busy are we on Fridays in this building? Or is there another day that is not,
Usually Thursdays are the busy day.
Thursdays are busy?
Is there, what about a Wednesday, or could we shift to a Tuesday? Maybe a Tuesday?
Tuesday's busy here?
No.
Okay,
Tuesdays can be
well, then
boring,
we can do a
right?
Tuesday.
They're always on Thursday? Oh, okay.
What about the 20th
of which,
of June
June?
on a Tuesday? Because that would be after the opioid summit, which I think would be good timing.
June the 20th, that works for me.
Works for me.
Tuesday, June 20th.
Uh,
Tommy?
I'm good with it.
10 o'clock, same time?
Sounds good to me.
I have an extra flyer and an extra. Did you need one?
Okay.
No, I'm good. I have one.
Did anyone need an extra?
Okay. And if you could, like brought up, if we could get the items to Tina to, detail what you want to discuss, and then also come with your evidence backing it up or the information supporting it. Help greatly. Okay, I don't have any other business. If nothing else coming up, we stand adjourned.